Hello, welcome to Anatomy DAHAR series. Today's topic is the mandible, basic and fine points for undergraduates and advanced programs. It includes two parts. Part 1 consists of parts of the mandible, surfaces of the mandible, and structures related to the external and internal surfaces. Part 2 consists of movements of the mandible, embryology and features in different age groups, and clinical correlations. Illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Author's note. Anatomy is a subject about structures of different parts of the body, their locations in relation to one another, and their possible bodily functions. Therefore, it is the basic and foundation subject in medicine. Considering the number of structures making up different parts of the body, anatomy is essentially composed of many names and facts. The problem is how to remember them. One way is by reading the text repeatedly, another by using mnemonics, and some follow other means such as discussions, etc. Personally, I believe in the saying, a picture is worth 1,000 words. Anatomy is considered as being composed of structures that can be readily visualized, and the subject can be learned through appropriate diagrams. In fact, learning anatomy without diagrams would be like sailing through uncharted waters without a compass. Learning anatomy from simple, clear, and well-illustrated diagrams may be considered the best way to learn and remember the subject. Studying such diagrams carefully would clearly reveal the locations and relations of the structures in the body and facilitate learning and remembering. Hence, I would like to suggest and advise the readers of Anatomy DAHAR series to try and learn anatomy through the diagrams, as I have provided good enough of diagrams in each topic. Thank you. Abdul Hamid, Abdul Rashid. Introduction. Mandible derives from the Latin word mandere, which means to chew. It is the lower jaw, the largest and strongest bone of the face. Let's see the diagram. This is base of the skull. This is two temporal bones, one on each side of the base of the skull. This is mandible. We are looking from behind, so it is posterior view. The unique feature of the mandible is a single bone articulates bilaterally with right and left temporal bones of the skull base and formed two temporomandibular joints, one on each side. Two articulations above provide the mandible more stable and strong in its functions for opening and closing the mouth, complex chewing, that is mastication, and side-to-side movements of the lower jaw, especially in biting and ripping. Mandible is commonly asked bone in the practical and viva voce examinations, especially in dental surgery courses. The mandible continuation. In this slide, we have two diagrams, diagram A and diagram B. Diagram A is the right half of the mandible looking from the right side, that is right lateral view. So, figure A, each half of the mandible is L-shaped, consists of a vertical part called ramus behind and horizontal part in front. This is the diagram B looking from in front, so you can see both halves of the mandible. This is right half and this is left half. So we can see the ramus of each half, and this is the anterior horizontal part. These two horizontal parts fuse along the anterior median plane and form a horseshoe-shaped body of the mandible. In human and primate, the lower jaw mandible does the opening of the mouth and chewing. However, in reptiles, the upper jaw takes those functions. Parts of the body of the mandible. We have two diagrams here. Diagram A is right lateral view of the right side of the mandible. Diagram B is looking from below, inferior view of the whole mandible. Anterior parts of the body of the mandible. Anterior part of the body of the mandible, this is the one, consists of two borders, upper and lower borders, and two surfaces, external and internal surfaces. Figure A. The upper border is the alveolar process, which carries 8 sockets with 8 teeth on each side in adult. The roots of the teeth cause rounded ridges. The canine ridge, number 2, this one, being the most prominent. Medial to the canine ridge is a shallow depression here. There's a shallow depression here below the incisor teeth and called incisive fossa. The lower border is the base of the mandible, number 4. In figure B, we are seeing the lower border of the mandible. This is the base throughout here. It is thick and rounded. That presents a small depression called digastric fossa, one on each side of the anterior median plane. This digastric fossa is a place where anterior belly of digastric muscles attached. External surface of the anterior part of the body. Look at the diagram. We are looking the mandible from in front. This is external surface of anterior part of the body. It presents 5 features. Number 1, symphysis menti. What is the meaning of symphysis menti? Symphysis means growing together. Menti comes from the word mentum, the chin. Symphysis menti is a faint ridge along the anterior midline, the only site of 2 halves of the mandible fuse. Next is mental protuberance. The symphysis menti expands below into triangular elevation called mental protuberance. That is point of the chin. Number 2. Infrolateral angles. That is inferior and lateral angle of this mental protuberance. We have mental tubercle, one on each side. Next is, here is symphysis menti. This is canine ridge. You know that. Between the symphysis menti and canine ridge, below the incisor teeth, we have a shallow area called incisive fossa. We have already mentioned in the previous slides. So we have 2 incisive fossa on either side of the symphysis menti. External surface of the lateral part of the body. Just now we mentioned about external surface of the anterior part of the body. From there we are coming laterally and we are going to talk about external surface of the lateral part of the body. This is the ramus of the mandible. This is anterior border of the ramus of the mandible. From there, there's a continuation of an oblique line, continues downwards and forwards to the mental tubercle. Next is mental foramen. It is below the interval between the first premolar and second premolar teeth. Here is the mental foramen, about midway between superior and inferior border in adult. It is the external opening of the mandibular canal, which is the passage for the alveolar nerve and vessels. We are going to discuss this one later. The canal consists of alveolar nerve and vessels, and its branches comes through this mental foramen as mental nerve and vessels. External surface of the ramus. We are coming from in front, from external surface of the body to posterior part, which is the external surface of the ramus. It is the posterior vertical part of the mandible, a flat plate of quadrilateral in shape. Each ramus consists of two surfaces, external and internal surfaces, and four borders: anterior border, which is sharp, posterior border, which is thick, inferior border, it is thicker, and superior border is here. Superior border consists of two upward projections. The one anterior is called coronoid process, number one, and the one posterior projections is condyloid process, number two. Between the two processes is semilunar shaped notch called mandibular notch. Surfaces of the ramus. The first is external surface of the ramus is flat and bears some oblique ridges over the angle, number 4, which are produced by the attachment of the masseter muscle. We have two diagrams here. Both are right lateral view. First is about the masseter muscle. The masseter muscle is attached almost the whole of the external surface of the mandibular ramus. Above and behind the masseter is covered by the parotid salivary glands. The second diagram is about the temporalis muscles, fan-shaped muscle with a very strong and long tendon. The tendon is inserted to the internal surface, apex, anterior border of the coronoid process and along the anterior margins of the ramus of the mandible, almost up to the lower third molar tooth. Here is lower third molar tooth. That means temporalis muscles, tendons is attached to the coronoid process, medial side, apex, anterior border of the coronoid process, and along the anterior border of the ramus of the mandible and extend down up to the lower third molar tooth. This is the diagram of the mandible, anterior view of the external surfaces of the mandible showing muscle attachments. Look here, this is the mandible. We are looking from in front. These are These are two rami, and this is the body. And let's talk about the muscle attachments of the mandible seen from in front. The first one on the external surface of the ramus is masseter muscles. We have already mentioned that one. Along the lower margins of the body is platysma muscles, very thin muscle, one of the muscles of the facial expression coming down from the face up to the upper part of the chest. And this is coronoid process attached by temporalis muscle, just now we have already mentioned. Continue down is bucciniter muscles on each side. If come down some more is depressor angula oris, that is angle of the mouth is depressed downwards. And next one is depressor labii inferioris, that is inferior lip of the mouth is depressed by this muscle. And another one is very new one, we haven't mentioned about this yet. This is condyloid process. Anterior surface of the condyloid process, we have another muscles comes and attach, lateral pterygoid muscles. We are going to talk this one later. So we know that this is masseter, this is platysma, this is temporalis on each side, and this is bucciniter muscle, this is depressor angula oris, this is depressor labii inferioris, and then this is lateral pterygoid muscle. Structures attached or related to the external surface of the mandible. This is external surface of right side of the mandible. This is anterior. This is body of the mandible. This is ramus of the mandible. These are two upward projections. This is coronoid process and this is condyloid process. What are the structures attached or related here? Very first one is the masseter muscles, number one, which is attached to the most of the lateral, that is external surface of the ramus of the mandible. Number two is temporalis muscle, very strong fan-shaped muscle, which is attached to the coronoid process, apex, medial surface, anterior surface. Actually, this is the muscular part of the temporalis muscle. Its tendon, strong tendons, comes down, we have already mentioned there, and attach along the anterior border of the ramus and right up to the third molar tooth, inferior part of the third molar tooth. These are all the tendinous part of the temporalis muscular part of the temporalis muscles here. Number three is bucciniter muscles, continuation from here. This is the bucciniter muscles. Number four, depressor angula oris muscles. We have already mentioned there. This is the depressor of the angle of the mouth, depressor angula oris. Another one is depressor labii inferioris muscle, which depress the lower lip. And then next is very small muscle here. Number six, mentalis muscles attached here, and number seven is the platysma muscles attached to the base of the mandible. It is one of the muscles of facial expression coming down from the face, crossing the base of the mandible and goes down to the neck up to the second costal cartilage level. Others are, just now we mentioned that tendon of the temporalis muscle, number 8. Number 9 is posterior part of the capsule of the temporomandibular joint. Posterior part of the capsule of the temporomandibular joint. Number 10 is mental nerve and vessels. Here, mental nerve and vessels coming out from the mental foramen. They are coming from the mandibular canal deep inside there. These are mental nerve and vessels coming out from the mental foramen. Next, number 11 is facial artery and facial vein. They crossing here and comes up to the face. And number 12 is mandibular branch of the facial nerve. It's very important. Most of the time, it doesn't reach below the lower border of the mandible. When it comes down to the lower border of the mandible, any incision here can injure this nerve and become the muscle which is supplied by this nerve will become paralyzed. And number 13 is the parotid gland, which is above and behind the masseter muscles around here, that is lateral part of the ramus. Let's see the diagram first. This diagram is left internal surface of the mandible. These are internal surface of left half of the mandible. So this is left medial pterygoid plate. This is little process called hamulus. Here is internal surface of the mandible, and this is third molar tooth. Between the hamulus and this internal surface of the mandible is raphe is there called pterygomandibular raphe. Now we are going to talk about pterygomandibular raphe. Superiorly, it is attached to the tip of the hamulus of the medial pterygoid plate, and inferiorly, it is attached to the internal surface of the body of the mandible just above the posterior, that is above the mylohyoid line, which we are going to see next, and which is below the third molar tooth around here. Pterygomandibular raphe provides common attachments for two muscles. Posteriorly is superior constrictor muscles and anteriorly is buccinator muscles. These two muscles originates from the pterygomandibular raphe. Internal surface of the anterior and lateral parts of the body. This is the right half of the mandible. We are looking the internal surface of the right half of the mandible. This is anterior part, which is the symphysis menti. We have already mentioned that this is inferior border of the mandible we call base, and at the base on either side of the anterior median plane we have one fossa each. That fossa is called digastric fossa, attached by the upper end of anterior belly of digastric muscles. This is internal surface of symphysis menti. In the internal surface on the symphysis menti, we have two pairs, that is 4 in number, of small spines are here. That is altogether 4 small spines called genial tubercles. You can see here superior 2 genial tubercles and inferior 2 genial tubercles are here. Okay, next we are going to talk about this oblique ridge. This oblique ridge is called mylohyoid line, which begins from the internal surface of the symphysis menti below the inferior genial tubercles. From this area, which is below the inferior genial tubercle, from there this oblique ridge, which is called mylohyoid line, extends up to the root of the third molar tooth. So this is mylohyoid line, big ridge on the internal surface of the body of the mandible. Above the posterior end of the mylohyoid line, we have a small area here that is the lower attachments of the pterygomandibular raphe. We have already mentioned that one, pterygomandibular raphe, which is extending from the hamulus of the medial pterygoid to this little area on the inner surface, internal surface of the mandible. So what is between the posterior end of the mylohyoid line and lower end of the pterygomandibular raphe? Between these two is very important nerve. Lingual nerve is located here. Internal surface of the lateral part of the body. Continuation. We are looking the same diagram here. This is internal surface of the body of the right half of the mandible. This is mylohyoid line we have already mentioned earlier. Now, behind the posterior end of the mylohyoid line, there is a groove is there, small groove is there, called mylohyoid groove. Along this groove, we have mylohyoid nerve and vessels run downwards and forwards. Then related to the mylohyoid line, one above the anterior part of the mylohyoid line and one below the posterior part of the mylohyoid lines are, we have two shallow fosses here. The one above the mylohyoid line and anterior to it is sublingual fossa, which occupy sublingual salivary glands. It is below the tongue, that's why we call sublingual salivary glands, located in the sublingual fossa here. Now, behind and below the mylohyoid line is another fossa is there, which is occupied by submandibular salivary glands. So it is called submandibular fossa is here. This is the superficial part of the submandibular gland is located here. Deep part will go around the mylohyoid line, that is the mylohyoid muscles, and deep part is deep to the mylohyoid line here. So this is submandibular salivary glands, superficial part. This is sublingual salivary glands will located here. Muscles attached to the internal surface of the body of the mandible. Internal surface of the body means anterior part of the body and lateral part of the body. In anterior part of the body, that is symphysis menti, internal surface, this is internal surface, it has two pairs of spine. This is superior genial spine, or also known as mental spine, and this is inferior genial spine. Each two spines, one on each side of the midline. So this is superior genial spine, you see from the sagittal section. This is superior genial spine if you are looking from behind. Below that is inferior genial spine pair, and here is inferior genial spine. What structures attached to the superior and what structure attached to the inferior genial spine? Superior genial spine is attached by very big genioglossus muscles, which runs up and attached to the tongue. And what about inferior genial spine? It is attached by geniohyoid muscles. If you see here, this is geniohyoid muscles attached to the hyoid bone behind. Now we are going to talk about the inner surface of the lateral part of the body of the mandible. Here we have mylohyoid line. We have already mentioned earlier, which arises from the back of, that is, internal surface of the symphysis menti, below the inferior genial spine, around this place. So this mylohyoid line started from this area below the inferior genial spine, and it runs up and posterior along the internal surface of the body up to the lower third molar tooth. So this is your mylohyoid line is there. So what structures attach along the mylohyoid line? Yes, it is attached by mylohyoid muscles. So this is the two parts of the mylohyoid muscles. Mylohyoid muscle is like a cutter shape coming down and meet its opposite part. Below, there's a raphe there. Above this is we have genohyoid muscle. Above that is we have genoglossus muscle. So most inferior is mylohyoid, cutter. Above it is genohyoid. Above that is genoglossus coming from superior genial spine. This one is coming from the inferior genial spine. Internal surface of the ramus of the mandible. We have already presented internal surface of the body of the mandible. Now we are going to present internal surface of the ramus of the mandible. Internal surface of the ramus of the mandible presents two features. Number one, mandibular foramen. This is mandibular foramen, which is located a little bit above the center of the ramus. It leads into the mandibular canal. Number three, which runs through the body and opens on the external surface as a mantle foramen. We have already mentioned that one. The mandibular canal is passed through by inferior alveolar nerve and vessels. At the mantle foramen, these nerve and vessel divides. Some will branch out through the mantle foramen as mantle nerve and vessels. Others will continue forward as incisive nerve and vessels supplying through the teeth, incisor teeth and canine tooth. Second feature is lingular process. Lingular in Latin means tongue. It is a small tongue-shaped projection on the anterior margin of the mandibular foramen. This lingular process is attached by inferior end of sphenomandibular ligament. We will discuss this one later. Internal surface of the ramus continuation. If you see the diagram, on the inner side of the ramus, you see two ligaments. The first one is sphenomandibular ligament and the second one is stylomandibular ligament. Now we are going to talk about sphenomandibular ligament. Number one, sphenomandibular ligament is the remnant of the perichondrium of the Meckel's cartilage, which developed from the mandibular process of the first pharyngeal arch. I hope you remember the development of the mandible. It develops from the first pharyngeal arch. So in the first pharyngeal arch, the first thing happened was Meckel's cartilage. It is surrounded by perichondrium, but Meckel's cartilage disappears. So perichondrium of the Meckel's cartilage is left behind and developed into sphenomandibular ligament. So from where the mandible developed? Mandible developed not from the Meckel's cartilage but from the mesenchymal tissue around the Meckel's cartilage. Now let's continue the sphenomandibular ligament. It is attached above to the spine of the sphenoid, here number 2, and below to the lingular process of the mandible. We have already mentioned about the lingular process. The lower part of the sphenomandibular ligament is pierced through by mylohyoid nerve and mylohyoid vessels. After that, they run along the mylohyoid groove, number 5. When the mouth opens, axis of the rotation is at the temporomandibular joint. But When the mouth opens wider, the axis of the rotations of the mandible moves down along the sphenomandibular ligament from the TM joint to the mandibular foramen. The second ligament, which is related to the inner surface of the ramus, is stylomandibular ligament. Number 1. It is a band of thickened deep cervical fascia which separates the parotid and submandibular salivary glands. It is attached above to the lateral surface of the styloid process. This is one, styloid process. Number 2, and below this ligament is attached to the angle and adjacent posterior border of the ramus of the mandible. Number 3. This ligament becomes taut when the mandible is protruded. Muscle attached to the internal surface of the ramus. Look at the diagram first. This is right half of the mandible. This is right temporomandibular joint. This is right ramus, and this is right ankle, and this is right body of the mandible. We are looking from behind, posterior view. The muscle which is attached to the inner surface of the ramus is medial pterygoid muscle. Number 1. It is quadrilateral shaped muscle, consists of 2 heads, superficial and deep heads. We are going to talk about its attachment to the mandible. So, medial pterygoid muscles is attached to the internal surface of the angle and ramus of the mandible. Internal surface of the angle and ramus of the mandible, as high as mandibular foramen above, this is the mandibular foramen, and as low forward as mylohyoid groove below. The internal surface of the ramus is flat and bears some oblique ridges over the angle produced by the medial pterygoid muscle. Medial relations of the ramus, that is, structures on the medial side of the inner surface of the ramus. Look at the diagram. This is the coronal sections of the right half of the mandible. We are looking from behind. What are the structures? This is base of the skull. This is right temporomandibular joint. This is right ramus of the mandible. This is the angle, that is right side of the mandible, and this is right half of the body of the mandible. So what are the structures on the medial sides of these part of the mandible? That means medial relations of the inner surface of the mandible. Number 1, this is maxillary vessels. Number 2, this is middle meningeal vessels coming from the maxillary vessels. And number 3 is inferior alveolar nerve and vessels. Number 4, sphenomandibular ligaments. Number 5, medial pterygoid muscles. Its lower end is attached to the ankle, and then lower part of the ramus of the mandible, and then chorda tympani nerve, number 6, and number 7 is wall of the pharynx. Borders of the ramus. Look at the diagram. Each ramus has 4 borders. Anterior border, which is sharp. Posterior border, it is thick. Inferior part, which is thicker, and superior border above here. The superior border bears 2 upward processes. The coronoid process, number 1, and condyloid process, number 2. Between them is a semilunar shaped notch called mandibular notch. Number 3. Coronoid process. Coronoid in Greek means hooked or curved, crow-beak appearance. It is located in front of the notch. Flattened triangular process with sharp apex attached by temporalis muscle. The condyloid process. The condyloid means in Latin knuckle-like. It is behind the mandibular notch. We have two diagrams here, diagram A and diagram B. Diagram A, we are showing the condyloid process. Condyloid process of the mandible is thick. Its upper end is the expanded head of the mandible, number 1. The long axis of the head is side to side, and the anteroposterior length is half of it. The head is covered by fibrocartilage and participated in the formation of temporomandibular joint. More detail, please see TM joint in Anatomy DAHAR series. The part below the head of the mandible is constricted part called the neck of the mandible. This is the neck of the mandible. Figure B. The neck of the mandible is attached by capsule of the temporomandibular joint. A depression on the anterior surface of the neck is pterygoid foveae. This is the one, pterygoid foveae, for the attachments of the lower head of the lateral pterygoid muscle. Lower head of the lateral pterygoid muscles will be attached to the pterygoid foveae, which is in front of the neck. Attachments of the pterygoid muscles to the temporomandibular joint and internal surface of the ramus. We have two diagrams here, diagram A and diagram B. Diagram A is seen from left lateral side. That is, this is anterior. We are looking from the left side. Diagram B is we are looking the TM joint and the left ramus from behind, posterior view. First is lateral pterygoid muscles. This is the one. It consists of two heads, upper and lower heads. Upper and lower heads. If you see from behind, this is the upper and lower head of the lateral pterygoid muscles. The upper head is attached to the anterior part of interarticular disc of the TM joint. You can see here, in both here, upper head is attached to the interarticular disc. Okay, and the lower head is attached to the pterygoid foveae, which is a little area in front of the neck of this condyloid process. So this is the lower head attached to the pterygoid foveae. Next is medial pterygoid muscle. You can see only in figure A. It also consists of two heads, superficial head and the deep head, which is larger. They are inserted to the inner, that is the internal surface of the ramus of the mandible. We have already stated this one earlier. Relations of the condyloid process and temporomandibular joint. We have two diagrams here, diagram A and diagram B. This is condyloid process and this is TM joint. This is we are looking from inside and this is we are looking from behind. This is medial view, this is posterior view. Now let's discuss about the relations of these two structures. Medial relations of the TM joint and condyloid process. Number 1 is middle meningeal artery, of course together with the vein. And then number 2 is maxillary artery and vein. Number 3 is auriculotemporal nerve coming from the mandibular nerve. And number 4 is sphenomandibular ligament. We have already discussed earlier. Lateral relations of these two structures. If you see laterally, we have number 5 branches of the facial nerve is here, which is covered by parotid gland number 6, and they are covered by the skin laterally. Structures attached or related to the internal surface of right mandible. Let's see the diagram first. This is anterior, this is posterior. This is internal surface of right half of the mandible. This is symphysis menti. This posterior surface is internal surface of the symphysis menti. This is internal surface of right body of the mandible, and this is internal surface of right ramus of the mandible. These two are internal surface of coronoid process and condyloid process, and this is head of the mandible. Let's see the structures attached or related to the internal surface of the right mandible. Number 1, medial pterygoid muscles. This is attachments of the medial pterygoid muscle to the internal surface of the angle of the mandible and lower part of the ramus of the mandible. Number 2 is lateral pterygoid muscle. This is lower head of lateral pterygoid muscles, which is attached to the pterygoid foveae, which is on the anterior part of the neck of the mandible. Number 3 is temporalis muscles, which is attached to the coronoid process, to the apex, to the medial surface, and along the anterior border of the ramus up to the lower part of the third molar tooth. This is temporalis muscle will be attached here. Number 4 is a very long muscle, mylohyoid muscles is here. It is attached along the mylohyoid line. Where does it begin? Look here. This is posterior surface of the symphysis menti, just below the inferior pair of mental tubercles. So this area, that is inner surface of the symphysis menti, below this inferior tubercles here, pair of tubercles here, from there mylohyoid muscle extends up and back along the mylohyoid line and up to lower part of the third molar tooth. And number 5 is we have two pairs of spine or tubercle, genial tubercle, superior pair and inferior pair. Superior pair is attached by genioglossus muscle coming from here to the glossus tongue, and the inferior pairs are attached by geniohyoid muscles. And next is number 6, anterior belly of digastric muscle. If you see below here, this is border of the mandible. On either side of the midline, we have two fossas. On one fossa on either side of the midline. This is attached by upper end of anterior belly of digastric muscle will be attached here. Next is number 7. This is number 7 along the base of the mandible, which is not attached by muscle, but it is attached by deep cervical fascia. And number 8, this green color near the third molar tooth is the attachment of lower end of pterygomandibular raphe. It forms a common attachment for two muscles, anteriorly buccinator muscles and posteriorly superior constrictor muscles. And number 9 is mylohyoid nerves and vessels running down along the mylohyoid groove. And number 10 is very important nerve. You can see here lingual nerve. It is between the posterior end of the mylohyoid and lower end of pterygomandibular raphe. Between pterygomandibular raphe and posterior end of the mylohyoid, this is the lingual nerve is there. And number 11, on the medial surface of the neck is, you can see here, that is auriculotemporal nerve coming down here. Number 12 is maxillary artery and vein, so maxillary vessels are there. Number 13, and nerve and vessels of the masseter, they are crossing the mandibular notch here to supply the from inside to outside to supply the masseter muscles. And number 14 is sublingual salivary glands, which is above the anterior part of the mylohyoid muscle, located in the sublingual fossa. Sublingual because these glands are below the tongue here, so they are sublingual salivary glands, which is above the anterior part of the mylohyoid muscle. And last, which is submandibular salivary glands, which lies below and behind, that is posterior part of the mylohyoid muscle. This is superficial part of the submandibular salivary glands. It will hook around, and deep part is lying above the mylohyoid muscle here. So this is the superficial part. All these are either attached or related to the internal surface of right mandible. Movements of the temporomandibular joint. There are three sets of mandibular, that is the lower jaw movements at the temporomandibular joints. They are, number 1, depression and elevation of the lower jaw to make the mouth open and close respectively. 2, protraction, that is protrusion and retraction, retrusion of the lower jaw. And 3, side to side, that is grinding, chewing movements of the lower jaw. Two groups of muscles are involved in movements of the temporomandibular joints. They are main group of muscles and accessory muscles of mastication. A. Opening of the mouth. 1. Slight opening, that is less than 22 mm. Heads of the mandible rotate around the transverse horizontal axis, that is the fulcrum, in the hinge-like movement. This is the one head. Here is the axis, transverse axis, which is the fulcrum. It occurs in the lower compartment of the TM joint, between the inferior aspect of the disc and head of the mandible, that is meniscomandibular compartment. It is done by the action of lateral pterygoid muscles and gravity. Continuation or opening of the mouth. Let's see the diagram. This is the head of the mandible. This is fossa for the head, and this is articular tubercle. Let's talk the second one, wide opening of the mouth. Rotation of the head of the mandible in slight opening of the mouth is followed by gliding of the disc and heads of the mandible forward and downwards to the articular tubercle. That means in wider opening, the head is now together with the disc glides forwards to beneath the tubercle. It is taken place in the upper, that is meniscotemporal compartment, and called translation. In this sequence of events, the mandible is depressed further by 1. Digastric muscle, 2. mylohyoid muscles, and genohyoid muscle. They are above the hyoid bone and called suprahyoid muscles, while the infrahyoid muscles, which are below the hyoid bone, act to stabilize the hyoid bone. They are infrahyoid muscle. Fulcrum means the point on which it turns or rotates. When slight opening of the mouth, head of the mandible rotates in the inferior compartment of the TM joint. Then the head is the center or fulcrum in this movement. But in wide opening of the mouth, the articular disc and head of the mandible glide forward together. The whole mandible rotates. The head is now moving forward along the circumference to the new position in front. Originally from here, it moves now forward as the whole mandible rotates. As the whole mandible rotates, see red arch, its center, the fulcrum of the arch, also moves slowly along the sphenomandibular ligament to the new position. That is the mandibular foramen on the medial surface of the mandible. As you know, at first the fulcrum was here, but later when the whole mandible rotates, the fulcrum is no more there. Fulcrum becomes center of this arch. Then this is the place. It moves down along the sphenomandibular ligament, finally reach to the new place at the mandibular foramen on the medial surface of the mandible. C. Closing of the mouth. It is the reverse movements of the opening of the mouth, gliding backwards of the articular disc and the head in the upper TM compartment, followed by reverse rotation of the head of the mandible in the lower TM compartment. They are done by 1. Temporalis muscles, 2. masseter muscles, and 3. medial pterygoid muscles. D. Protraction, that is forward movements of the mandible. Both articular discs and heads of the mandible together glide forwards in the upper TM compartment, that is meniscotemporal compartment, but without depression or elevations of the mandible. Both masseters and all 4 lateral and medial pterygoids are involved in such movement. This is lateral pterygoid, this is medial pterygoid, and this is masseter. So all 4 muscles, all these muscles on both sides will act in this action. Number E. Retraction, that is backward movement of the mandible. That is a reversal of protraction. In this case, both articular disc and head of the mandible together glide backwards in the upper TM compartment, that is meniscotemporal compartment. In this movement, the muscles involved are number 1, middle and deep fibers of the masseter, and number 2, digastric muscles assisted by genohyoid muscles. F. Side to side, that is chewing movements of the mandible. Let's see the diagram. Superior view of the mandibles. Let's concentrate number A. You see here, this is head of the mandibles. This is right head of mandible. This is left head of mandible. Let's start. Right head of the mandible glides forwards together with its articular disc, like in protrusion. It is due to the actions of medial pterygoid, lateral pterygoid, and masseter of same side, ipsilateral side. At the same time, on the left side, that is left head of the mandible, merely rotates on its vertical axis. There is no gliding movement is there. As a result, the chin moves forwards and towards the left side. The rotating part, this part, is called working part. This is one, WP. But the opposite one, which is non-rotating part, is called non-working part, NWP. These movements occur alternately in right and left DM joints for side-to-side movements. Basic embryology. The first pharyngeal arch consists of two portions, the dorsal portion, the maxillary process, and the ventral portion, the mandibular process. This is right lateral view of the embryo. This is first pharyngeal arch. This is the dorsal portions, maxillary process, and this is ventral portions, the mandibular process. Mesoderm is the middle of the three embryonic layers. Mesenchyme is the embryonic connective tissue in the mesoderm. In a further development of the mesenchyme of the first arch, some of the components ossify to become bones, some form muscle tissues, and others become ligamentous or disappear. This is the right lateral view of the embryo. This is maxillary process and this is mandibular process. The maxillary process, the mesenchyme of the maxillary process gives rise to premaxillar, maxillar, zygomatic bone and part of the temporal bone through membranous ossification. Premaxillar, maxillar, zygomatic bone and part of the temporal bone formed through membranous ossification. All are bones of the upper jaw. The mandibular process, this is the one which is more important. The mandibular process contains number 1, Meckel's cartilage, which is wrapped around by the covering, that is perichondral membrane of the cartilage, and they are surrounded by number 3, mesenchyme, that is the connective tissue of the mesoderm of the mandibular process. Mandibular process of the first arch. This is right lateral view of the embryo. This is mandibular process of the first arch. This is the second arch. During further development of the mandibular process, Meckel's cartilage disappears except for its dorsal end that forms two ossicles of the middle ear, malleus and incus. The perichondral around the Meckel's cartilage becomes ligamentous, that is sphenomandibular ligament. So from where does the mandible develop? The mandible does not develop from the Meckel's cartilage because it has been disappeared. The mandible is developed from the mesenchymal tissue surrounding the Meckel's cartilage by both intramembranous and endochondral ossifications. Development of the mandible, continuation. This is right lateral view of the mandible. This is symphysis menti. This is body of the mandible, and this is ramus of the mandible, and this is two upward projections. This is coronoid process and condyloid process. This is mental foramen. You can see from the external surface of the body of the mandible. This is mandibular foramen on the internal surface of the ramus of the mandible. The part between the mandibular foramen and mental foramen is developed by membranous ossification, A. The part medial to the mental foramen, this is the one, medial to the mental foramen is developed by endochondral ossification, area B. Coronoid and condyloid processes ossify from secondary cartilages, C, not related to the Meckel's cartilage. Each half of the mandible ossifies from only one center, which appears during the 7th week of intrauterine life. It is the second earliest bone to ossify in the body, clavicle being the first. The other centers appear during the 10th week of intrauterine life. At birth, the mandible consists of two halves connected at the symphysis mentae by cartilaginous nodules. During the first year of age, the bony union at the symphysis mentae starts from below upwards and is completed at the end of 3rd year. Features of the mandible in different age group. This column is features, this column is for children, this column is for in adult, and this is in old age. The first feature is angle of the mandible. In children, it is about 140 degrees, in adult about 110 degrees, and in old age, it is about 140 degrees. Mental foramen, position of mental foramen. In children, it is nearer to the lower border. In adult, about midway between the upper and the lower borders, and in adult, nearer to the upper border. Mandibular canal. In children, it runs near the lower border. In adult, it runs parallel with the mylohyoid line, and in old age, it runs near the upper border. Condylar and coronoid processes. In children, coronoid process is higher. In adult, condylar process is higher, and in old age, coronoid process is higher. Please see the explanation in next slide. Explanation of the features of the mandible in different age groups. In children and in old age, there is no teeth between the upper and lower jaws. In children, the teeth are not erupted yet, still inside the alveolar parts, and in old age, however, they have already fell off. Therefore, the upper and the lower jaws are touching with absence of the wide gap between them. The ramus and the body of the mandible are more or less along the same plane, and thus the angle is wide, about 140 degrees in children and in old age groups. But in adult, the teeth are present and the gap between the two jaws widen. However, head of the condyloid process remained at the same place at the temporomandibular joint. The ramus becomes more upright. The angle between the ramus and the body becomes narrow, about 110 degrees. In children, the teeth are still inside the alveolar of the body. The mental foramen and the mandibular canal are therefore away from the upper margins of the alveolar and nearer to the lower border of the body. However, in old age, the teeth are fell off. The alveolar part of the body is absorbed. The mental foramen is nearer to the upper border. In children and in old age, as the angle between the ramus and body widened, the ramus inclined, leaned backwards, together with the condyloid process. The head of the condyloid process becomes at the lower level than that of the apex of the coronoid process. Clinical correlations of the mandible. We have two diagrams here, diagram A and diagram B. Diagram A is showing sites of common fracture and their percentages. The mandible is commonly fractured at three sites that are weak following violent injuries. They are: number 1, neck of the mandible, because it is constricted and narrow, 35%. The angle of the mandible, because of abrupt change in direction and force, 45%. The canine region of the body, because the root of the canine teeth is prolonged and reduce the bony mass. It may lead to malalignment. Here is 15%. When the mandible is fractured, let's take the commonest site, the angle of the mandible. Mandible bone will be divided into two at the fracture site, proximal part and distal part. What will happen? The proximal part will be pulled up by temporalis muscles, which is attached here, and the distal part and the chin will be pulled down by geniohyoid, digastric, and hyoglossus muscles. Now let's talk about diagram A here. The area just lateral to the chin in diagram A, just lateral to the chin. It is the site of the world's only 8 weight categories boxing champion, pound for pound, Manny Pacquiao's favorite knockout spot. The end, illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Now is a good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available to you. Anatomy DAHAR series also provides other videos related to the present topic. Enjoy and thanks for watching.